basically I'm just talking about or highlighting some work we're doing around harmonising the work we've been doing with the clinical registry with the National Stroke Foundation Audit program, and that's coming under the umbrella of the Stroke 123 initiative. So really the main goal of that is to avoid duplication of effort and to simplify and streamline coordination efforts cost effectively. So, you know, we see that the work that we're doing overlaps with, you know, the work that the NSF team are doing. And although, you know, we've been quite good at working together to help with different facets of that, it's really important that we can be smarter about how we do it, because there is no core funding for any of these activities. So basically, Stroke 123 is a partnership grant funded by the NH and MRC, and it includes several elements. One of those elements is the rollout of OSCAR and various activities around quality improvement, including the NSF StrokeLink program, which will be Kelvin will explain. And what we're doing there is to actually show the benefits of that linked approach that was described by Erin in the national framework. So taking data, looking at you know, clinical performance in various hospitals, and then using that to drive an evidence-based quality improvement program by providing facilitated workshops, peer support throughout that process, and supporting clinicians in their behaviour change activities. So we're doing that in Queensland as a historical control prospective healthcare intervention. We're also undertaking as part of that process the harmonisation with the OSCAR and the audit. And we're also very much mindful that we need to start to address the data linkage issues, because, you know, it is quite complicated, and I'm very grateful for those from the data linkage units from different parts of Australia who have come here today and will be contributing to our workshop this afternoon. So importantly, one of the first things that we'll be doing is linking OSCAR data to the National Death Index, and that's important for two reasons. One is to ensure that we understand what's happened to the losses to follow up. So with the OSCAR, we actually collect patient outcomes, so quality of life information that's not available in any other format at 3 months to 180 days maximum point after their stroke onset. And the other thing is to, you know, think about, you know, if we can link those data up routinely, we can also understand about mortality rates in the longer term, so 1, 2 or 3 years after stroke. So in a nutshell, Stroke 123 looks like this. It includes a data linkage and how we can address efficiently monitoring stroke care performance. Contained within that, we have our multi-centre sub-study within Queensland, and then right through the whole process we have a separate committee that's involved in thinking about how we immediately translate into policy and practice the things that we're learning along the way. And I think that's critical. So we've got several subcommittees that are assisting with that process, and we're ensuring that we have committee members that are from various jurisdictions and policy representatives, so that we can actually take them on our journey with us as we learn along the way. So as I said, we've got 3 subcommittees. We've got a National Data Linkage Committee, we've got a Clinical Data Harmonisation Committee, which is focused specifically on how we bring audit and OSCAR together. And we've also got a Quality Improvement Committee that's chaired by Rowan Grimley in Queensland. And I just highlight that this is a separate version of the egg, but the benefits of the data linkage are really around the fact that we've got our minimum data set in OSCAR that overlaps with the national audit, which is really specific around quality improvement measures. And then, you know, there's very little overlap with what we have in hospital administration data, and emergency department presentations can be linked up, as well as information on deaths. But if you bring that all together, you actually have a very large data set that can be interrogated for a whole range of research questions without having to ask people to collect that data again. And it's actually maximising the use of that data. So what have we planned this year? It wasn't something we could do immediately, like just harmonise the 2 programs. This is an audit year for acute care, and OSCAR is focused on acute care at the moment. So what we do is we're taking hospitals that are involved in the National Stroke Foundation Audit. The data for the period of the audit that they need uploaded, we will extract that and we will import it in a de-identified format into the new audit tool that's being developed this year. That will then mean that clinicians who are participating in the audit, who are also involved in OSCA, do not have to enter the same data twice. It means that it's pre-populated and they can fill in just the extra variables that are missing. We can also use that to check whether the OSCA registry actually has complete ascertainment for that period. So it's also a way in which hospitals might then improve the data that they've got in the registry for that period if they find that they've missed some of their cases. Where we want to get to is this future vision that will be discussed shortly, which is to have a national stroke quality of care super tool, whereby you have OSCA embedded within that, which is prospectively collected on all patients, and then you have the optional expanded variable set such as the National Stroke Foundation Audit that can happen periodically, and that may also include other elements such as also doing the rehabilitation audit as part of the same patient set of data. So the other thing that's important is that we can design and embed statistical linkage keys, because then we can link to other registries that have the same statistical linkage key to develop. So we're working carefully with the Australian Rehabilitation Outcomes Centre, and Francis is here today, to make sure that our statistical linkage key can be matched to the Rehabilitation Outcomes Registry so that we can bring those data together. And they're just the partners involved in the Stroke 123 project.